This is a red light therapy device, and if you're thinking about incorporating this into your hair loss routine, you are in luck. Because today we're going to explore how red light therapy potentially works to help stimulate new hair growth and what hair loss conditions will most benefit from this therapy. One of the things that I find very interesting is that we discovered the ability for red light therapy to stimulate hair growth almost 50 years ago. It was back in 1967 when a cancer researcher was looking at mice and using red light therapy. And they found that actually they were stimulating hair growth, patches of hair to grow on these mice. It wasn't until 2007 that we got the first FDA cleared device to use red light therapy to treat androgenetic alopecia, which is the most common form of hair loss for both men and women. So there's a rich history of red light therapy being used in both dermatology and hair loss for quite a while. Red light therapy, also known as low-level laser therapy or LLT, is a non-invasive therapy that you can do at home. What's so crazy to think about is that we are using wavelengths of light, red light specifically, to make changes in our own body. And this is called photobiomodulation. There were a lot of studies done looking at what is the ideal wavelength to stimulate hair growth. And they looked at 600 nanometers to 950 nanometers. And we have narrowed it down to about 650 nanometers as being the ideal wavelength to stimulate new hair growth. Packets of light that are filled with energy, penetrate through the scalp and get down to the hair bulge, where there's a concentration of stem cells. Those hair bulges are being modified on a cellular level to upregulate transcription factors. And that has an impact in terms of stimulating new hair growth. It helps our hair stay in the growth phase, and it helps stimulate new blood circulation to the scalp. So there's a lot of benefits to using red light therapy, and it's quite amazing that we can use light to make changes to our hair. I do believe that red light therapy is an important tool to help address hair loss. If you're someone who happens to have androgenetic alopecia, which is the most common form of hair loss for both men and women, red light therapy is demonstrated to be very helpful. If you're someone who has alopecia areata, which is coin-shaped patches of hair loss, in conjunction with medical therapy, again, red light therapy has been shown to be useful to help stimulate new hair growth. It's also a great device for people who are experiencing telogen effluvium. This is hair loss that can be induced from stress or a stressful event in one's life. And I particularly like this device for women who are experiencing hair loss after pregnancy, because there's a lot of medications and a lot of things that you can't put in your body when you're breastfeeding. I actually made an entire video on this, so I encourage you to check it out. But the whole point is, yes, this device has a role to play in addressing hair loss, and it can be used in conjunction with other therapies. So even if you're someone who is on finasteride or dutasteride or minoxidil or spironolactone or doing PRP in the office or mesotherapy, you can do red light therapy at home. Actually, with some of our hair transplant patients, we have them go home with the red light therapy device because we think that helps with the recovery of the hair follicles. Now, one of the challenges with this device is that you have to be consistent. And it's very hard sometimes to be compliant because you have to use this device on almost a daily basis in some cases. And you have to use it for a couple of minutes or sometimes up to 30 minutes every time you put the helmet on or use the comb. So compliance is really challenging. So I don't recommend this device to every single person because I have to think about, are you going to be able to actually maintain the therapy? Because once you stop using the device, it's going to stop having its impact. So if you're someone who's really looking for, number one, a way to stimulate hair growth and you don't want to be on medication or you don't want to use other therapies, well, this is certainly a device to consider. And if you are on any of those medical therapies, you can use this device as well. But I would just caution you and just make you think for a second and make you step back and say, well, are you going to be compliant? Because once you start using a red light device, you don't really want to stop because you're not going to get the benefits. It's not that you can't stop. There's nothing bad that's going to happen to your hair, but you're not going to get the value of purchasing one of these items unless you're going to actually use them. Now, we certainly discussed that you can use a red light therapy device in the convenience of your home, but there is the option of having red light therapy done in an office environment where the environment is controlled. And in some cases, the red light therapy that you receive at an office has higher energy and might be more effective. Now, I do want to emphasize the other thing, that if you do start red light therapy, there is a potential to have an initial shedding phase where the hair that was in the resting phase will fall out, getting ready for new hair growth. The other thing to emphasize is that if you're using red light therapy devices at home, there's a possibility that you might develop headaches or hypersensitivity to the actual device that you're using. Now, I do want to caution that if you're someone who has photosensitivity issues or any skin cancers on your scalp, I would not recommend using a red light therapy device out of precaution that it might make your condition worse. With that said, red light therapy is very safe to address your hair loss, and I do recommend this to many of my patients. If you have any questions that I have not addressed about red light therapy that you want to ask me, please leave them in the comments below. And as always, I'm here to help you.